Excuse me, everybody. Hi, everybody. This is Ramona coming back at you. Okay, so I'm going to hit this one out of the ballpark because I've been waiting very long for this. And I know that at the time that I had made my first gastro bypass log, I've gotten some subscribers, and so I'm believing that there are a few people out there who are really looking forward to hearing my logs on this. And so I want to make this log. Okay, so this is going to be all the information that you need because I actually went to the seminar. Now, first, let me start off by saying that the first thing that you have to do is you have to go see your doctor, your overall regular doctor, okay? She or he is the one who's going to give you a referral or a letter. So, you can either get a letter or a referral that they'll send on to the bariatric office, okay? That's number one. She or he has to okay you first. Once you get that, the reason why is because she or he, your doctor, has all of your medical history, and they'll be the ones to know whether you will really benefit from this or not, or even if you qualify or not. So yes, and also that's just the procedure and how they do it. You have to get a referral. That's first. That's number one. So anyways, I did that, and the reason why it took me so long to make a log is because I was actually waiting for them to give me, for the bariatric office to call me with an actual appointment, because I don't know how, at that point, how it went down. I didn't know who I was going to see next, but they called me, and they said that the second step, after you get a referral, the second step is actually going to an informational seminar. Okay, and by the way, I should add that I am going to have the surgery done at the Brigham and Women's Hospital. It's one of the best hospitals out there. I mean, I think they're there's a top 4 hospital in this nation, and they're one of them. So, and also Faulkner Hospital is another one that's right up there. So I'm going to be at the Brigham and Women's Hospital, but basically all of these procedures, steps that I'm going to tell you about how it's going to go down, that's basically everywhere. Okay, there might be little tweaks here and there of how it might be different in some other state, but this is how it goes down here. So I received a phone call from them, and then I went to the informational seminar they asked me, and then I got this packet, and everything that's in this packet and the extra information that the doctor, because the speech happened was given by a doctor and a nutritionist and an insurance the medical insurance person. So that's who the speech was, the seminar was given by. And I'm going to tell you exactly what they have told me. So, I just did like a 20-minute video before that. I didn't like how it came out, so I'm just really trying to get out there more efficiently, more clear. So, what is it called? So I have been calling it the bariatric surgery, but I've been calling it the gastro bypass surgery, but really there are all of the weight loss procedures, surgery. The whole thing is called bariatric surgery. So a bariatric procedures. That's what all of them are called. The gastro bypass is actually just one kind of procedure. So just so you know that's what it's called, bariatric surgery. Okay, bariatric weight loss. The next thing I want to talk about is, because I have my notes here, the next thing is qualifications. Okay, yeah. So what are your qualifications? They're going to give you, they go by what is called a BMI chart. What BMI stands for is body mass index, okay? And if you go online and you look up a chart like that, it'll say differently, but you put in all your figures and basically it'll calculate what your BMI is. Your BMI is important because of as far as qualifications go, because it dictates whether you're going to qualify for the surgery or you don't, okay? So they gave a BMI chart that looks like this. Well, this is it. And so on the column here, down here, these are the, I'm not sure if you guys can see it, but down this very skinny column is your height. Is your height. I'm going to go by the 5'8". Why? Because I'm 5'8". So I'm going to give the 5'8" example, okay? These other columns, we have 4 columns here. The first column is normal, the second column is overweight, the third column is obese, and the fourth column is extreme obesity. Now, if you're normal weight, you cannot get the surgery, the bariatric surgery. If you are overweight, you cannot get the bariatric surgery. So that would be the 29% body mass index. That if you're in the 29 percentile, you cannot get the surgery. Now, if you're even in the, you have to actually be at least 35%. You actually have to be in the 35%. This light is like bothering me, and it's really hot in my house. You can see my cheeks are red. You have to be at least in the 35 percentile now of a BMI. But if you fall anywhere between the 35 and 39 BMI percentile, you can get the surgery, but only if you have complications. Now, if you fall under between the 35 and the 39 percentile, you have to have, like, of weight, you have to have type 2 diabetes, high blood pressure, and sleep apnea, okay? Now, if you fall under the 40 percentile, which means that you're extreme obese, then, which sadly I fall into the extreme obese, so, which is 40% and above, so that would be between 40 and 54 percentile for your body mass. You don't have to have any complications. You qualify for the surgery. Okay, so let's move it on. Next one, kinds of bariatric surgeries. Let me turn to that page. Okay. So, oh Lord. Okay, so the comparison of procedures. Now, there are 3 kinds of bariatric surgeries. There's a gastric bypass, the gastric banding, and the sleeve gastrectomy. Okay? Those are the 3 kinds. Down on this column, it says technique, length of surgery, time in hospital, return to work, weight loss, risk of death, reversal of procedures, and other issues, okay? So let's talk about the gastric banding. According to the doctor, he said, oh my goodness, okay. So according to the doctor, he said that is one of the safest procedures. However, it's the least effective. Okay, there are people who've gotten the lap band. So that's another way. Gastric banding is like the lap band. Lap band is just a name brand, okay, lap band. They said that that's the least effective. Why is that the least effective? It's because with this, you can just high calorie food such as fattening drinks like soda and high fructose juice can go down into the canal, okay, of the, I'm going to explain that in a minute. And so people actually just there's a lot of people who end up not losing weight with that. Also, if you do if you do lose weight, it's the lowest percentage of weight that you can lose with this, which is 40 to 45%, which I'm going to go down that list in a minute. Also, problems with the lap band. The band can actually, what the band is, what it is, okay, is they put this circular plastic piece around the stomach. So here's the stomach. So the lap band will go completely around the stomach, and in time you have to go back. You have to go back a few times for them to, if you're not losing the weight, if it's not working, they'll make the stomach even smaller and smaller and smaller and smaller and smaller and smaller. Of course, not small enough to completely close it off, but really small. And they do that by, there's a string from the band, okay, and they do that so they can just actually shoot saline up into the tube, which tightens the band, okay. So complications with that is that the band can actually slip. It can actually tilt. You can actually have to go back and have surgery once again to have it fixed, replaced, or tilted, and you can have like really bad heartburn with that. It's just hospitals tend to really not want to do the lap band. It's just very ineffective. In fact, he was saying that this hospital, you guys can look up the Brigham and Women's, how huge it is. The Brigham and Women's Hospital is so huge that it's not even one place. It's actually in many different places around Boston because there's just no room to fit it all in one building. Even though this building is gigantously huge. Actually adding a brand new building. It's just a really big hospital, okay? They buy 50 of them. 50 for yeah, okay, that's it. And he said, if you wanted to buy a part of that, the lap band business, you can buy it actually 21 cents on the dollar. That's how cheap, they're out of business, basically. They're still in business, but nobody buys the hospitals do not buy the lap band because it's just so ineffective. The most safest, but that's the only thing that you're getting out of it that's really great. So let me go down here. If you choose to still get the lap band, it's done by, all of these surgeries, all three of them are done by laparoscope. I can't say the word. Laparoscopic. So that's LAPAROSCOPIC. Laparoscopic. What that is that they slice a hole in your tummy, and then they put a tube. There's like a light at the end of it, and then they go in and they do the surgery that way. Okay, so that's how they do the procedure, all of the procedures, but that's how they do this, what we're talking about. The length of surgery is 1 hour. The time in the hospital is 1 day. Return back to work in 1 week. The most you can hope to lose with a lap band, if you lose any weight really, is between 40 and 45% in a 2-year time span. So everything that you're going to lose off of your body with all of these procedures, all 3 of these procedures, is within 2 years, okay? You, of of course lose weight, tremendous amounts of weight through that time, but your optimum best amount of weight that you can lose is between 40 and 45% with this procedure. Risk of death is 0.1%, and I think that he says that out of 1,000. But then he had doubled that up with saying that nationwide. So I don't know which one to go with that. Reversal of procedure, yes. If medically necessary, they can take that right out. Okay, so let's go to the next best one, which is the sleeve gastrectomy. What is a sleeve gastrectomy? Okay, now your stomach is shaped like a lima bean. So let's just, I don't have a lima bean shaped hand. So let's just say this is the curve of a lima bean, okay? And so what they do is they start from the middle of the stomach, slice it down. They're cutting half of the stomach into a backwards L, so that way, okay? And they just take out the entire other half of the stomach, and then they sew it onto your intestines, okay? So you basically just only have half of your stomach to work with, okay? This is also very effective. The most that you can lose with this is 50 in a 2-year time frame, which is the most you can lose. After the end of 2 years is 50% of your weight. So if you weigh 300 pounds, the most you can lose is 150. You'll go down to 150, which is that's pretty decent. So let's go down. Let's go down the list of what you can expect with the sleeve gastrectomy. Okay, so once again, a laparoscopic procedure and how they do it. The length of surgery is between 1 and 2 hours. Time in the hospital, 2 days. Return back to work in 2 weeks. Once again, the most you can lose, your optimum amount you can lose is 50% of your weight. Risk of death is between 1 and 0.5, so that's half of. Oh, no. Okay, so. Oh, okay, so they said between 1% or 0.5% of death rate. So that's so minimum, can you reverse this? Absolutely not. You cannot reverse this. Now, the most effective, most common, which they will probably do on you depending on your body, health issues, what have you, that's what they will go back and forth. The lap band, I'm telling you that they most likely will not do that unless you really highly want to request that. But if it's up to them, they won't. But they will, so the doctors would really, if it's up to the doctors, they will either go by the gastric bypass or the sleeve gastrectomy. Where was I going with that? So the gastric bypass, now that is what I'm going to be getting, okay? So that is the most common. That is something that the doctors will most likely go by. If you don't have any really bad medical complications, or there's no reason for you to not get the gastric bypass, they will go with gastric bypass. The awesome benefits from this one is from the gastric bypass is 2 things, which I'm going to mention again, but you can lose 60 to 70%. So that's like the most. I'm like, there's no ifs, ands, or buts about it. You're going to lose weight with this one. So this is a 60% for the optimum amount of weight that you can lose in a 2-year time span is between 60 and 70%. So that's a really good. That's what they're talking about, most effective. And another thing that will. Another thing that is a really beneficial from this, if you have diabetes, this after your surgery, this will knock out of out of you. You will not. Most patients who have diabetes do not need insulin any longer. They don't have diabetes anymore. It actually disappears. In the worst case scenario, if your diabetes does not go away and if you still need insulin, which he said that's very rare, not as severe as before. Like I know nothing about insulin. I don't know nothing about diabetes because I don't have it. I am borderline diabetic, but I don't have it yet. So I can't tell you like how wonderful that would be if you didn't have to take insulin. But I imagine that would be really amazingly wonderful if you could, So now I'm gonna go down a list. Okay, so first let me tell you what the gastric bypass is. So they basically take okay, so basically I'm pretty sure that this is how it is. Okay, so the reason why it's called bypass is because they don't touch your stomach at all. Basically, here is your intestine, okay, and here's your stomach. So basically, they cut, I believe, on top, because there's a tube from like your throat or whatever. I don't know. Like there's a little bit of something up here, and then they cut the stomach. They cut that tube from the top of your stomach, and then they go all the way down to your small intestine, right? And then they sew your small intestine to the top of your tube in your stomach. Yeah. So they don't cut your stomach. They don't cut it out. They don't put a lap band around it. They don't touch your stomach whatsoever. They're just reconnecting. They're really basically cutting out like a big, gigantously huge chunk of your intestine. So everything is basically going right through. They do leave a bit of your intestine, but it's basically just going from in your mouth and down to your butt. Okay, of course, the body's complicated, but that's basically how it is. Okay, so the gastric bypass, how's it done? Like I said, once again, it's laparoscopic. I told you what that is, didn't I? How they cut you in the tummy and then they put the microscope, but they have the light under there, and that's how they see and they do everything, okay? The length of surgery is 2 hours. Time in the hospital, 2 days. Return back to return back to work, 2 weeks. Once again, I've said with a weight loss, 60 to 70% in a 2-year time frame. The risk of death is only 0.5%. The reversal of the procedure, it is possible, but they say it's very, very difficult to do. So they'll do anything and everything to help you out in every way before they will even attempt to do the surgery again, because it's really difficult. Other issues is the only category that does have some issue, another issue that the other categories don't, which is called the dumping syndrome. What is a dumping syndrome? The dumping syndrome is when you have weakness, you have weakness, you have stomach cramps, you just feel overall, diarrhea and that kind of thing, you know what I mean? But what he had said, the likelihood of getting dumping syndrome, it's not the likelihood, but getting dumping syndrome, patients who get dumping syndrome are the ones who are just throw caution in the wind. There are, which I'm going to get to, there are post-op procedures that you have to, not procedures, but post-op things that you have to do, pre-op and post-op. I don't know if they call it pre-op, okay, but like before and after, they want to make sure that you are at your optimum height of wellness, okay, before they touch you and then after the surgery. But as far as the dumping syndrome, people who they're not exercising, they're not eating right, they're eating cookies and sugar and milk and blah, 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 blah. They're packing it in, they're stretching out their stomach where they can actually like just actually can come apart, if you're doing that, just sitting there, emotional eating, just it can actually just mess you up. They don't even go back to see the doctor until 2 years, when they're just like so far from. That's not acceptable. They don't exercise. They don't work out. They don't do anything they're supposed to. And with that, you get this dumping syndrome where you do feel diarrhea and weak and just overall just having issues with your stomach. Okay. So, what's the next one? Number 3. That leads us to number 3. And I'm glad that I had just mentioned that, which is right here. This information doubles up for a few things. Basically, how long will it take before you get your bariatric surgery done? Okay. But because of what I just said, I want to touch on this. What classes or doctor's appointments do you have to take before your big day, your big surgery? One of the things, and then I'm going to go down a list, but because I mentioned another thing before, I'm going to mention this. You cannot be mentally unsound. They absolutely will not touch you if you are mentally unsound. You have to take a lot of classes. I think you have to actually take 3 of Powell classes. So what that is Powell. Okay, so the Powell thing is actually the weight loss group that you have to attend to. So basically, you have to go to a nutrition class group. You have to do a lifetime nutrition appointments. Okay, so and also you have to go to the pre-op weight loss Powell group, and then the last thing they have to do is the bariatric forum. I just lost my train of thought. Oh my gosh. Did you shut off that heat? I'm like I think that I'm just overloaded here. And please, I know it's cold out, but could you please open the window? I'm not even thinking right because it's so damn hot. God, it's like 90 degrees, 95 degrees now, no joke. 525,600 minutes. But the other one too. Okay. Sorry about that, guys. Okay. So hot, and I'm like. Okay. So I want to point out that after you see the Powell group, like the list of things that I just told you, and then also your pre-op weight loss group, the bariatric forum, you have to go to, which I just did, the educational preparation, and all of these things that you have to go through. But let me tell you something. So there's not a direct one-on-one sitting down with a psychiatrist to see if you're mentally sound. But in this time, it's going to take you, depending on your body, it's going to take, from the healthiest is going to take you about 3 months before you even get the surgery. Because this is all the classes that you have to take, everything that's going to go down, which I've just mentioned. It's going to take about 3 months. It's going to take 3 months, 6 months if you're really they're really paying attention to see if you're mentally unsound in this time. So how do they find out if you're mentally unsound? Or, you know what I mean? you're going to have to be in direct contact with the team, because it's called the team, at all. During the 3 months, there's going to be a lot of phone calls back and forth between you and the team, the bariatric team. They're going to keep in contact with you a lot. So believe me, you're not going to be alone in this. This is you and the bariatric team are going to become friends, if you will. And they're going to keep an eye on you to see if you're unsound. They're going to see if you're argumentative, your attitude. They're going to see how you carry yourself. Like, are you okay? Are you okay up there? They're going to see if you keep all your doctor's appointments. They're going to watch if you're depressed. Are you a depressed person? The problem with that, even if you just do have like 10 bouts of depression, not even bouts of depression, but if you're going through like a long-term crisis depression mode, there's a problem with that because of your nutrition intake. So you might be susceptible to, oh my God, that feels so good, to overeating or undereating. So that's why they're really, even if you're not nuts up there, but you're just depressed, they'll probably wait for you to feel better with that as well. So keep that in mind, okay? Okay, so let's just skip down to the other portion of what I said. How long before surgery? So once again, first thing, you have to get, which I'm kind of being repetitive, but I just want to make sure that you know the step by step what's going to happen, okay? So once again, you're going to have to get the referral from your regular doctor. That's going to take a while. Like, remember how it took me 2 weeks for them to actually even call me back after the fact that they got the, I feel dizzy. It's this light and everything, and I'm hot. That took them like 2 weeks for them to get back to me. I mean, that's a big chunk of the time. So we're just calculating how long this is going to take before the surgery. So then you're going to have to do an educational preparation. So the very steps is the seminar that I already went in to collect these papers. Then you're going to have to go with the insurance route, which the insurance assistance. I'm going to talk about that in a minute. This is going to be a bit of a long videos, but if you're interested, it's good information. Then the last step with that is the bariatric forum. Okay. So the mental well-being is the next thing listed. So the mental well-being is, like I said, I'm not going to explain that again, but they're watching you. They keep an eye on through this whole process to see how well you're doing. So the pre-op weight loss, they want to see how you're dealing with that. Okay, so I'm not going to repeat like the whole depression, how you may overeat, undereat, but also. I guess you're going to, the last thing you're going to do is do the bariatric forum. So, and then also you're going to have to see the nutrition team, which is the group nutritional classes, then the lifetime. You're also going to have to do lifetime nutritional appointments. Once again, open phone or online support, back and forth. They're going to keep an eye on you. Pre-op weight loss, which I've already mentioned, the bariatric. Okay, so that's basically the steps. That's all going to take about 3 months to 6 months. Before I go on with the payment, in insurance, I want to fill in some of the things that's not in this packet. Remember how you told me your ultimate fantasy was to have an 11. I'm not actually going to mention like the smaller details. I'm going to wait for actually when I go through it. But I was going to talking about like and which will probably be in the bariatric forum, because this is like days leading up before the surgery, like what kind of drinks you have to have, what you can have, what you can't. I'm not going to talk about that right now, which I was going to. There's two things. Okay, so smoking. If you are a smoker, they absolutely will not touch you with a 10-foot pole. You must quit. Nobody, at least not this hospital too, they will not touch you if you are a smoker. And I had asked them, how long do you have to be a non-smoker before you will allow for the surgery? And they said 3 months. You have to be a smoker at least for 3 months. Why? Because they want to make sure that you're not going to go back. Yeah. Okay. So another fact too that kind of stuck out to me, which is which I do not take vitamins on a regular basis, but I just would love to be able to do that anyways, surgery or not. But you will be on a lifetime supply of vitamins. You know, obviously. Okay. So let's go down to 2 more things, which is down payment. Now this is a pain in the ass, okay? All right, so, and this is also the payment timeline. Assuming that you're going to be using your insurance from your job or any kind of insurance that you have, you are going to have to put down $550 out of pocket, because your insurance will not pay for the first $550. What does the $550? Let me see. Hold on, let me just read this. Okay, so $100 is absolute, you have to put it down on the table. They will not even start your nutritional groups. You need the $100. You need to walk into the hospital with $100. You're not leaving with it, I mean. And after that, the other $450, they'll do a payment plan with you. I don't know how good of a payment plan that they will have for you. I don't know if they'll give you like 2 months to take it off. Which that's like $225 a month or something like that. I don't know. But you do have 6 weeks to pay that off. Oh, so there's that answer. Okay, so what is 6 weeks? So basically you have 2 months to pay this off. Okay, and they will not give you the surgery unless this is paid off, okay? So that's one thing that you'll need to know, that you will have to walk into the hospital with a $550 payment on the table. Now, if you choose not to give the the reason why you have to pay $550 is because for the nutritional thing, the hospital does not allow, I guess, I don't know why they don't allow it, or maybe just most insurance people don't take it, or the hospital won't take it for some reason. I don't know, but it's most likely insurance that they won't cover the nutritional portion of the procedures, the steps, okay? If you choose not to go on with the surgery and you paid off the entire $550, they will keep $100. They will keep that $100, the first initial deposit. Okay, then they will refund your $450 back. Now your insurance. Everybody is required to call their insurance company. Even if you know yourself that it's going to be covered by your insurance, you have to call, because they absolutely will. I think that they want proof that you actually called the company, because they don't want oh, she started the classes. Oh, okay, so you're not going to pay it after you've done all this. You know what I mean? So they want hard copy proof, okay? Okay. Oh, so we already covered the $550. So. What was it like having the privilege of performing the work of Oscar winner Diablo? Okay, so yeah, basically yeah, and then I. Sound like an interview answer. There are, I think, I don't remember the names of the insurance companies, but there are at least 3 insurance companies that will not help you out. As the doctor has pointed out, your insurance company is not your ally. They will fight nail and tooth for you to not get the surgery. So you're really gonna have to fight, and advocate for yourself to really fight for your money. You know what I mean? Because that's what insurance companies do. So he made that very clear. Like, you're gonna have some issues with your insurance company, but bottom line is that if it's covered, they should pay for it. But there are 3 different kind of insurance companies that absolutely will not pay for this. So, and that's why you need to call your insurance company to figure that out. Okay, now the weight loss is good. Okay, so just so you know, like for the classes that you have to take, now this is not something that you call and make an appointment for. They have an online site that tells you when your appointments are, or you can call and see, not appointments, I said appointments, but you can call online for the general information. Seminars, because there are seminars. There's going to be like 100 people in that room, so it's just not one-on-one or group of 5 nutritional classes and all that business. This is like 100 people sitting in a conference room, or whatever you would call it. Okay, so that's basically how it is. So